This chapter covers integumentary or skin diseases and disorders. Dermatophytosis is another term here is tinea. It's chronic fungal infection of the skin. Um, they'll usually have a border in the lesions with some scaling. Different types that you might see is tinea capitis, tinea corpus, tinea unguum, tinea pedis, and tinea crucis. Capitis is going to be more head, corpus is going to be ringworm, and unguum is going to be nail. Tinea capitis usually looks like little round gray scaly lesions, and they're usually on the top of the head. They are contagious. Um, they tend to spread among children. You don't usually see it in adults. Tinea corporus, or ringworm, the round ring-shaped, scaled with lesions, kind of looks like a little raised area. We see it more commonly in the country or in hot, humid climates. Usually, you see it more in people who have contact with infected animals, especially cats. Tinea unguum is most commonly affecting the toenails. Um, Usually it starts with one and may continue to additional nails. The nails will look hypertrophic or really thickened. When you look at the nail from the end, it will be um, the thickness can be, yeah, up to a quarter of an inch even. It'll be really brittle. It will also, where nails tend to have that um, almost glossy appearance, it will tend to look almost like a deadened look. Tinea pedis is basically, by appearance, is inflamed. It's dry. It's peeling. It's cracking, and you see these most commonly on between the toes and on the bottoms of the feet. Um, Usually, you don't see these in children simply because of the cause. Tinea crucis, um, raised red itchy vesicles in the groin area. See it more commonly in men, and you see it more commonly in the summer months or whenever they're sharing locker rooms and those kind of things. Um, it's intensified with physical activity, by sweating, tight fitting clothes, and that kind of thing. Then we typically refer to this as athlete's foot, and you can see this sometimes in high school and college locker room areas where uh, they joint use showers, and so if one person comes in with it, they shower in a shower, and of course it's not thoroughly cleaned from that, and then somebody else goes in and uses a shower. They can actually share that. Tinea crucis, um, raised red itchy vesicles in the groin area. See it more commonly in men, and you see it more commonly in the summer months or whenever they're sharing locker rooms and those kind of things. Um, it's intensified with physical activity, by sweating, tight fitting clothes, and that kind of thing. Then we typically refer to this as athlete's foot, and you can see this sometimes in high school and college locker room areas where uh, they joint use showers, and so if one person comes in with it, they shower in a shower, and of course it's not thoroughly cleaned from that, and then somebody else goes in and uses a shower. They can actually share that. Tinea crucis, um, raised red itchy vesicles in the groin area. See it more commonly in men, and you see it more commonly in the summer months or whenever they're sharing locker rooms and those kind of things. Um, it's intensified with physical activity, by sweating, tight fitting clothes, and that kind of thing. Then we typically refer to this as athlete's foot, and you can see this sometimes in high school and college locker room areas where uh, they joint use showers, and so if one person comes in with it, they shower in a shower, and of course it's not thoroughly cleaned from that, and then somebody else goes in and uses a shower, they can actually share that. Dermatophytosis, transmitted by contact with a fungus or the spores of the fungus. Um, there's several types of fungus or fungi types that may be involved. They get in the skin or the nails, um, affect those. There's antifungal medications. Anytime you have a fungus, typically antifungal medications is going to be your treatment. These are topical um, or ointment type treatment, or they can have versions that require um, that will be treated orally. Um, Skin has to be kept clean and dry. Decubitus ulcer, um, and also called very commonly a pressure ulcer or a bed sore. It's basically an area of dead skin that can be in any of the layers of the skin, the dermis, epidermis, or the subcutaneous. Um, Typically, you see those in patients who are bed patients, such as hospital or nursing home facility, but it could be someone who comes into the office that um, has had to be somewhat immobile for a time period. Usually, it's diagnosed by what you see. They may do a culture and sensitivity to see what else might be included, but it's usually red, shiny skin over a bony prominence. Um, so that patient at home that maybe they've had a significant leg fracture and they're not able to get up much, and so they're laying in the bed, let's say, 20 hours out of 24, and maybe only getting up and sitting for an hour or two beyond that. um, and so they're sitting on the pressure is constantly on the skin over a certain joint. For instance, hip would be a common area, and so it's bony projections that have layers of skin tissue are the key points where you usually see this, and it's in large part because of the potential for lack of blood supply to those areas. One of the keys with decubitus ulcers is finding where they're beginning. When you start seeing that first change in the skin, and then making sure that you prevent it from developing any further and getting into other layers of the skin. Um, it depends also on the general physical health of the patient to begin with, um, and besides trying to keep pressure off of that particular area. Um, so looking at the skin, watching for breakdown of the skin, um, and trying to keep any of those bony areas of the skin um, from getting too much pressure on them. And whenever the patients are bed patients, usually they want them to be turned or change position every couple of hours, and that's the reason that they do it. Another thing would be doing some maybe some passive range of motion exercises. In other words, someone comes in and moves their arms or legs or whatever instead of maybe them doing it. Might There's also some special equipment, for instance, you might do. Treatment-wise, medication, use topical medications, absorbable gel sponges, um, carry patches, antiseptic irritations, debriding, getting out all of that old dead tissue down to where it's more healthy, and of course antibiotics.